What's up, you guys? Welcome back to the channel. Today I want to talk about an exciting topic that's been gaining a lot of traction online in the biohacking and longevity community, and this is Tadalafil, also known as Cialis. Today we're going to focus on the non-erectile dysfunction uses of Tadalafil. We'll go through the data on cardiovascular and endothelial health, muscle recovery and exercise capacity, the anti-inflammatory and antioxidant effects of Tadalafil, metabolic health and insulin sensitivity, cognitive function and neuroprotection, and immune modulation and cancer support. And if you're not already a subscriber, consider hitting that subscribe button. So first off, what is Tadalafil? Tadalafil is a long-acting phosphodiesterase 5 inhibitor. It's a long name for an enzyme that basically boosts nitric oxide production via inhibition of a molecule known as cyclic GMP. Nitric oxide is a potent vasodilator which helps blood vessels to relax, increasing blood flow and helping with circulation. Tadalafil, unlike its cousin sildenafil, also known as Viagra, has a much longer half-life. The half-life is around 17.5 hours, making Tadalafil effective for up to 36 hours. While sildenafil, you're looking at about a 4-hour effective range window. Let's dive into the cardiovascular and endothelial benefits of Tadalafil. And spoiler alert, these are some of the most striking numbers I've seen when researching a medication in a very long time. So keep in mind, as we're going through these studies, many of these studies were done on men who already had erectile dysfunction, and if you have erectile dysfunction, it means that you have some sort of vascular compromise already going on. Your blood isn't flowing as efficiently as it should be. So in one study of 8,000 men with erectile dysfunction who took Tadalafil, they saw a 19% lower rate of major cardiovascular adverse events, think heart attacks and anything that's life-threatening related to your heart, and a shocking 44% decrease in all-cause mortality. And another study with over 500,000 men showed that use of Tadalafil was linked to a 27% decreased risk of heart attack and a 34% decreased risk of stroke and all-cause mortality. So we have this range in between these two studies of 34 to 44% decreased risk of all-cause mortality. That is an insane number, y'all. That is extremely high. And for both of these studies, the dosage used was 5 milligrams daily, which is one of the lowest doses used. For comparison's sake, for pulmonary artery hypertension, 40 milligrams per day of Tadalafil is typically the dosage used. Now let's talk about muscle recovery and exercise capacity. This has been getting a lot of traction on Reddit in the biohacking community because theoretically, Tadalafil should increase blood flow to skeletal muscle, increasing aerobic capacity, and helping with muscle recovery. One study looked at a single 20 milligram dose of Tadalafil in healthy athletes and found no effect on sprint performance. Another study looked at a 2-day course of 20 milligrams each of Tadalafil and actually found that Tadalafil increased negative markers of oxidative stress on the body. And we're going to kind of see this trend as we go through the data. The effects of Tadalafil are much less in people who are healthy with a normally functioning vascular system. The most profound effects are seen in the opposite group, people with erectile dysfunction or people who already have a compromised vascular system. And in one study with men who had mild metabolic syndrome, 5 milligrams of Tadalafil daily for 2 months increased lean muscle mass by about 4% and improved insulin sensitivity. And we're going to talk about insulin sensitivity here in a little bit, but 4% is a pretty remarkable number for a lean mass gain from just taking a small dose of a medication. Now let's go on to the anti-inflammatory and antioxidant effects of Tadalafil. The study we're going to reference now looked at markers of chronic stress, and these are interleukins 6, 17, and 18 in patients who had prostate enlargement and erectile dysfunction. 5 milligrams daily for 6 months lowered all of these interleukin markers of chronic stress, IL-6, 17, and 18, and also pro-inflammatory CD4, CD28 negative T cells. Don't worry about the nuance here. These are just a subset of T cells in your immune system that are pro-inflammatory instead of anti-inflammatory. And we're going to talk about anti-inflammatory T cell lineage when we get to the cancer section. In this same group of individuals, they noticed increased cognitive scores and brain activity using that same dose of 5 milligrams a day for 6 months. Now let's talk about metabolic health and insulin sensitivity in regards to Tadalafil. Patients who are diabetic who took 5 milligrams of Tadalafil daily dropped their hemoglobin A1C by 0.4% and their fasting glucose by 11 milligrams per deciliter. Just to put this in perspective, this is a pretty substantial drop. If you're in the pre-diabetic range, this can get you out of that range, assuming that it has the same effect in people who have pre-diabetes as with people with diabetes, which we know when it comes to vascular health is not the case. People who have compromised vascular system have a much more robust response to Tadalafil than people who have a healthy vascular system like athletes. Another study showed that Tadalafil improved muscle insulin sensitivity, which helps with glucose uptake into the muscle. muscles. So if you're working out and your muscles are metabolically active, they're actively pulling glucose out of circulation to metabolize it into energy, and insulin is the carrier molecule that makes this happen. So you want the receptors for insulin on your muscles to be more sensitive so it can pull more glucose out of circulation to effectively metabolize it. And finally, when it comes to hormonal effects, patients who had metabolic syndrome who took Tadalafil noticed an increased testosterone to estrogen ratio. And this could be a contributing factor to the lean muscle mass gain that we mentioned earlier. All right, let's jump into one of the most exciting categories, cognitive function and neuroprotection. Large database studies show that patients on PDE5 inhibitors like Tadalafil had a 25 to 32% lowered risk of dementia. That being said, when it comes to clinical trials, one trial looked at 20 milligrams daily of Tadalafil and showed no evidence of cognitive improvement. But like we mentioned earlier, in the study of the patients who were on 5 milligrams daily who already had inflammation-mediated cognitive impairment, Tadalafil helped to reverse this and helped to improve their cognitive function. The data for cognitive function and neuroprotection seems to be mixed, but it doesn't appear to be detrimental, and if anything, extremely promising. Okay, so finally our last category, immune modulation and cancer support. In one study of patients who had head and neck cancer, 10 milligrams of Tadalafil reduced myeloid-derived suppressor cells and T regulatory cells. Both of these lineages of cells work to actually dampen the immune system, and in a state of cancer, you want your immune system ramped up to recognize cancerous cells. So by suppressing these regulatory T cells, you're actually improving your immune system's response to cancer. And then in another study that's near and dear to my heart because it's about melanoma, Tadalafil improved tumor immunity and survival trends. So the bottom line here is that Tadalafil's effects extend, no pun intended, well beyond erectile dysfunction. The benefits span from improving metabolic health, improving vascular function, potentially improving cognitive function, and maybe even supporting immunity. Here are the key takeaways. Most of the benefits seen in Tadalafil outside of pulmonary artery hypertension was seen at low doses taken daily. Think 5 milligrams taken daily. The most profound effects of Tadalafil are seen in people who already have a compromised vascular system. The effects seen in patients who have a healthy functioning vascular system like athletes don't seem to be as profound. And finally, off-label use of Tadalafil should always be done under medical guidance, so always check with your doctor if you decide you want to start Tadalafil for longevity or biohacking or for whatever reason outside of its on-label use. We definitely need more research on Tadalafil, which I think will be coming out in the coming years as this drug has gained more traction and people are starting to waken up to the effects outside of its intended use. Thank you guys for tuning in. Like, comment, and subscribe. Drop me a comment with any questions you have, and I'll see you guys soon.